Dr. Ava, I noticed we have quite a few chickenpox cases scheduled for this week. I realize I don't know as much about it as I'd like. Can you tell me more about it?
Of course, Alex. Chickenpox is a highly contagious infection caused by the varicella-zoster virus. It's most recognized by its itchy, blister-like rash spreading across the body. The symptoms start appearing about 10 to 21 days after being exposed to the virus. It begins with fever, tiredness, headache, and then progresses to a rash that forms blisters and eventually scabs over.
That sounds quite uncomfortable. How can someone tell it's chickenpox for sure?
Diagnosis usually involves looking at the rash and considering recent exposure history. In uncertain cases, lab tests can confirm it.
Is everyone at equal risk of catching chickenpox?
Not exactly, Alex. While anyone can get chickenpox, it's more common in children under 10. Adults and immunocompromised individuals who get it tend to experience more severe symptoms.
What happens after someone gets chickenpox? Does it get better on its own?
Yes, in healthy children, chickenpox is usually mild and heals within 2 weeks. However, it's crucial to avoid scratching to prevent scarring or secondary infections.
So what can be done to treat it, or better yet, prevent it?
For treatment, we focus on relieving symptoms, like using calamine lotion for the itch and antipyretics for fever. Prevention is key, though, and the chickenpox vaccine is a safe and effective way to prevent it. Want to hear some interesting facts about chickenpox?
Absolutely.
Firstly, once you've had chickenpox, you're usually immune for life, though the virus stays dormant and can reactivate as shingles later on. Secondly, chickenpox was once considered a rite of passage for children. And lastly, the vaccine has led to a dramatic decrease in cases and complications from the virus. Here are a few more fascinating facts about chickenpox. Did you know that chickenpox parties were once a thing?
Really? What's a chickenpox party?
Before the vaccine was available, parents would sometimes expose their children to another child with chickenpox on purpose, hoping they would get the illness and become immune. It's not recommended now due to potential severe complications.
That's quite a strategy. What else is there to know?
Well, chickenpox has been around for centuries. It was initially confused with smallpox until the late 19th century when its distinction was finally made clear.
That's a long time to confuse two diseases. Anything else?
Absolutely. Another fact is that the name chickenpox doesn't come from chickens at all. There are several theories about the origin of the name, but one popular suggestion is that it's derived from the Old English word gicken, which means to itch.
So, no chickens involved. Got it. This has been really enlightening, Dr. Ava.
I'm glad to hear that, Alex. Knowledge and awareness are crucial, especially in healthcare. Sharing information like this not only educates, but can also make our jobs a bit more interesting.
Dr. Ava, thank you for sharing your knowledge with me. I feel much more prepared to help our patients now.
You're welcome, Alex. It's important to spread awareness and understanding about diseases like chickenpox. Education is a powerful tool in healthcare.